pretty clear that there's been a big change in our eating patterns over the past 30 years. We're eating a lot more sweet things, a lot more starchy things, processed foods. We're eating about the same amount of vegetables as we were. We're eating less meat. And I think that if you look at the changes, they would tend to favor an increase in body weight. More calories, more processing yields an increase in body weight. If we look at some of the factors that let's try this again. If we look at these factors, it would seem like, why don't we just change our diets and lose weight? And one of the key points is that eating fattening food, whether it's too much sugar, starch, whether it's too much fat, seems to do something to the brain that makes it hard to lose weight. So once you start to gain, many people will tell you that it's really hard to just go back. Very few people can just turn around and begin to lose weight. And this is one of the parts of obesity that is not understood well at all, and it's very misunderstood in the public. Why don't people just lose weight? If it were that easy, I wouldn't have a job. We wouldn't be talking about this topic. So something that people have to understand is that fattening foods change your brain in a way that makes it difficult to lose weight. That's why it's so hard to turn this thing around. When it comes to obesity treatment in adults, I think that we've suffered from oversimplifying the problem by giving people oversimplified advice and by not looking at some of the underpinnings of what's maintaining the increased body weight. We take a more diagnostic approach. We look for causes of obesity that may be making it difficult for the patient to lose weight. For example, many medications can make it difficult for someone to lose and may contribute to the weight gain. We've estimated that about 10% of the obesity in this country is caused by medications that are being prescribed. There are other conditions like sleep apnea that may make it difficult for a patient to concentrate and focus if the sleep apnea is present and not appropriately treated. So just telling someone to lose weight, just handing them a sheet of a diet, is not going to deal with those kinds of problems. And if we don't take this type of approach, then the patient's frustrated because they don't lose weight, the doctor's frustrated because the patient's not listening to them, and everybody just gives up. So we've made significant progress taking a more sophisticated approach in adults, where we try to diagnose problems that can be diagnosed, fix things that can be fixed, and if the patient can't lose weight with dietary changes alone, and we favor lower carbohydrate diets. Not a no carbohydrate diet, but a lower carbohydrate diet that gives patients a greater sense of fullness. Then we use medication. We've used many different medications. There are 2 new medicines that have been approved by the FDA, one called Qsymia, the other is Belviq. And we find that using those in appropriate patients can be very successful, can really help people to continue to comply with an appropriate diet. It's not instead of a diet and activity program, but if someone can't comply with that program, using medication makes an awful lot of sense. So right now in this country, we have a situation which is the Grand Canyon of care. That in obesity, what happens is that you have people on a diet and exercise program, and then if they don't succeed and their body mass index is high enough, they go for surgery. So there's nothing between diet and activity and surgery. And that doesn't fit the medical paradigm that we have in other areas. There need to be other steps to take, number one, before someone gets to the point of surgery, and number two, shouldn't we be using things like medications to see if we can treat some of those people who would you like to stop someone from needing surgery? I think that most people would prefer not to have an operation. And this is a part of care that's been totally lost. One reason is because of a poor understanding of the pathophysiology of obesity. Again, in the minds of physicians and the public, it's oversimplified. I'm eating too much. If I don't eat too much, then I'll lose weight. That is not completely what's going on. You do need to eat less in order to lose weight, but there are certain diets that make you eat less, and there are certain medications that can make you eat less and can stimulate your metabolism. And by using this more sophisticated approach, we find that there are a number of people who are close to needing surgery, where we can bring them back from the brink. People who've had surgery. We treat people who've had surgery and they haven't done very well. How could that be that someone has surgery and then they start to regain? We find that there are physical causes that may be related to their diet, but that starts a feed-forward mechanism, what I've called and other people have called a feed-forward mechanism that makes it harder and harder for someone to comply with their diet. And ultimately, they can gain a significant amount of weight. How do you pull them back? We find that using medications for weight loss can be very helpful in a patient who's had surgery. And we do this quite often. This is what we do all day long, and I think that a trend is going to be the medicalization of obesity, where patients who have complications, I'm not saying someone who wants to lose 10 pounds now, I'm talking about someone who has comorbid conditions that are associated with obesity. The typical patient we see is taking 8 medications, and they have sleep apnea. Their body mass index is 37, so they're on the verge of needing surgery if they don't already need it. But those kinds of patients should be managed in the medical realm. They represent about a third of the people who are obese. So if you think of a third of the population is obese, and 1/3 of those people, maybe up to 40%, are heavy enough and ill enough to need this type of more intensive intervention. But those people cost more than 60 to 70% of the healthcare costs that are attributed to obesity. So if we focus our attention on these people and treat them properly, I think we can make great strides in healthcare in general.